Armenia, December the 7th, 1988. Thousands of lives were lost during the devastating earthquake. Its aftermath was destruction and pain. The whole world extended helping hands to Armenia. Fund for Armenian Relief and Dr. Edgar Hovsepian were amongst the first. The logical continuation of FAR health programs was the establishment of FAR Fellows Alumni Association. After the earthquake of 1988, the Fund for Armenian Relief was established by the United States Armenian Church East Diocese Primacy and initiated a number of humanitarian projects in Armenia. The main focus was on medical projects. These projects initially focused on bringing US doctors to provide medical aid to Armenia, after which local doctors would be retrained in major clinics in the United States. That is to say, FAR devotes a significant part of its medical projects to the education and retraining of doctors. During these years, the development of a national medical library has permanently been at the center of attention of FAR and especially of Professor Edgar Hovsepian. Attaching great importance to the role of the library in the medical, educational, and scientific procedures, Professor Hovsepian has made every effort to promote the development of the library through various programs. As a result, the library has been successful in promoting the professional growth of physicians through its modern information services. Over the past 20 years, numerous physicians, after retraining in different cities of the United States, particularly at Columbia University, New York, continue to practice in Armenia. And the experience and knowledge that the doctors received during this retraining and cooperation is inestimable. In the 1990s, I had the opportunity to receive retraining in Columbia University under the guidance of Professor Hovsepian, the Director of Medical Projects. Being an eminent mentor, scientist and organizer, he has been the Director of Medical Projects for many years. During these years, an enormous amount of work has been done through his direct participation. Various specialists in different fields have been given not only professional education, but have been trained on how to work with people. And all this was thanks to Dr. Hovsepian.
Dr. Hovsepian's շնորհիվ է։
It was 1990 when I left for the USA to receive retraining through the FAR Medical Project. It was my first contact with Western and Eastern medicine. Time passed, and together with FAR, I applied for a grant and acquired neurophysiological apparatus for Armenia. Today, the apparatus is in use in Yerevan Medical University. It provides precise diagnoses of neuromuscular diseases for the whole of the Republic. After returning to Armenia, I tried to implement what I have seen in the USA. Firstly in No. 2 Hospital in Vanadzor, and later on in the Medical University Hospital in Yerevan. It is the right approach, and it showed how we, the doctors, should use our personal experience and knowledge not only to help our patients, but also to share with our colleagues.
1995 թվականին ինձ բախտ վիճակվեց FAR-ի ծրագրով մեկնել Միացյալ Նահանգներ.
In 1995, through a FAR project, I had the opportunity to visit New York and receive retraining in one of the best American children's intensive therapy departments in New York Hospital, the head of which is Dr. Daniel Notham. Fortunately, it became possible to gradually introduce into Armenia most of the things I learned during those 3 months, and even achieve unexpected results. It is very gratifying. After returning, we, the retrained fellows of FAR, discussed at length the issue of organizing retrainings in our country. Fortunately, FAR succeeded in organizing and implementing its own project of doctors continuing retraining, due to which the knowledge that we had gained in the USA gradually spread to all the regions of Armenia. Today I want to speak of how Yerevan State Medical University cooperates with the medical team of FAR. Being a representative of the medical team of FAR and initiating these retraining projects, 2 years ago we understood that we have a great number of trainers who work in the medical university. On a volunteer basis, all our trainers welcomed our regional doctors. Today, this cooperation is regulated by relevant regulations. FAR implements such a 1-month project, and Yerevan State Medical University has 2-month retraining programs. This cooperation is also good in the sense that one FAR project marked the establishment by the university of a retraining project of its own, and in my opinion the State Medical University and FAR projects complement each other and are currently among the best training projects in Armenia.
Այսօր Հայաստանում լավագույն վերապատրաստման ծրագրերից մեկն է։
Իհարկե հայտնի է եւ այդ հայտնի մոտեցումը.
Of course, it is known that FAR was able to exercise that well-known approach in Armenia. Because if we do not educate our young specialists, we won't have any progress. And this served as the basis for the first FAR project. However, no progress will be achieved if the educated don't share their knowledge with others. And it managed to cover all of Armenia like a fan, opening in all directions for all specialties, covering all regions and all medical institutions. Of course, we should be proud of this. The educational program started by FAR were continued by FAR FAA. The Salzburg International Medical Seminar Program has been managed by FAR FAA since 2003, and over 470 Armenian physicians have participated in one-week seminars in Salzburg, where they meet American, European faculty and update their knowledge and skills in medical science. For over 4 years, thanks to FAR support, the FAR FAA has been implementing the continuing medical education program for the provincial physicians of Armenia. Through the continuing medical education program, 180 physicians from various regions of the Republic of Armenia have been given the opportunity to participate in 1-month trainings at the leading hospitals of Yerevan and become updated on the most recent innovations in different fields of medicine. The importance of the project lies particularly in the fact that due to the social and economic conditions during those years, doctors working in remote districts had no opportunity to receive retraining. The lack of information and communication with leading specialists couldn't but have its negative effects. Because of this, the quality of healthcare in remote villages visibly declined year by year. And in this situation, I would like to once again mention the efforts of FAR, and in particular Professor Edgar Hovsepian. The enormous work, which often is not visible to us, and the money that is collected with great difficulty, and which is readily provided for the implementation of such projects. I would just like to let you know the results. During 4 years, we already have 170 retrained doctors who are in close cooperation with leading specialists in the capital. Numerous pieces of medical equipment have been provided to the hospitals in remote regions, which has also contributed to the improvement in the quality of health care. I want to say the following. It is wonderful when there are alternatives for doctors' retraining and the doctor himself decides in which clinic and especially what kind of knowledge he wishes to receive. FAR gives us such an opportunity. As a hospital director, I'm often in contact with doctors who, for this or that reason, mention as an essential factor that it's they who should choose what kind of knowledge to gain. And many of our doctors have benefited from these one-month retraining courses. I believe that choosing is correct and reasonable. God grant that it will be ongoing. I would like to take the opportunity to add that we, the graduates of FAR Medical Project, are grateful to Dr. Hovsepian in particular, and we are proud of having been given the chance to personally meet and communicate with this eminent man, famous doctor and benefactor.